Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, welcome to The Lionhearted. Today, the podcast is a continuation of case acceptance. Case acceptance is second to none in how your weeks and how your months and years are laid out for you. Whether you walk in every Monday to challenging procedures that you're going to be doing, as opposed to a single crown here, two fillings over here, etc., etc. You're working on cases that you treatment plan that are the net result of you creating a process. And this time that you're investing by listening to me is to help you develop that process. So let's continue. On the last one, we really didn't get any further than the new patient phone call, which is fine because if you don't have a tremendous process there, then everything else I'm telling you will not work. It's got to get off. That patient has to hang up that phone from that first phone call and already feel that this place is a little different. This place feels, wow, nobody kind of talked to me like that over the phone before. And have a good positive reaction to that. And we're not quite done with that part, so I want to give you a little bit more. But that's the goal, for them to hang up and receive the package in the mail that you're going to send, the welcome a new patient letter. And by the way, any of these things that you want, please write to Beth or myself at the email that she posts up on these videos, on these podcasts, excuse me. I guess, Beth, you can do it audio-wise too. Because all the information that I talk about, I want you to literally have. And there's no cost for this, so good gracious, what do you have to lose? So the last thing I had spoken about was going over the protocols of what's going to happen at that first visit when they come to you. And I talked about the key essential comment, which was, let me tell you how this first visit's going to work. I mean, that's all you really have to say, and then explain the need for a full examination in the right tone of voice with the right words. We call that the mini dental. We're doing this after we've done already a mini dental history. Go back at the other podcast and look that over. And then now, if it's appropriate, you need to bring up the subject of bringing the significant other to this first visit. So let's talk about that for a minute. Look, if they call you up and say, I've been wanting to come to you for years and I'm finally making the switch, you're going to love my mouth. I go to the dentist every 4 months. The whole hygienist love and compliment my mouth. Then no, you don't have to ask them to bring their significant other. You know, if it's an 18-year-old, a child of one of your patients, no, you don't have to do that. But when they indicate significant need, or even maybe significant need, maybe they'll say they haven't been to a dentist in 3 years. Maybe they'll say, I've had a root canal and a crown on this root canal tooth done 3 times, and it's come off a 4th time, and I'm something like that. When you know in the back of your head, you could be thinking crown lengthening, you could be thinking parafunction, and you could be thinking the need for an extraction and an implant, anything like that. Michelle will say, well, let me tell you, we've been here a long time, and we recommend, if there's any way possible, that if you have a significant other in your life, to bring them with you. Now, in an earlier podcast, I gave you Michelle's email, which is Michelle, Michele, at pearlsmiles.com. So you can feel free to, and you should, follow this up by asking her more specifics if you need it. All I can tell you is this. It's rare that I don't have the significant other at my visit if they've indicated remotely the concept of need, of something going on. And I'm not talking about just the patients that call up and say, "Oh, I'm so upset. I'm almost embarrassed in my mouth." I don't mean that. I'm just talking even about, in addition to that, a situation like I just described. And you're not going to get 100% of these patients, of course, to bring their significant other. And every time you don't, you've increased the risk of no case acceptance significantly. Listen, anybody that knows me knows that when I give this information, whether it's live, in person, or in this form, I keep it real. So why? Why do I even bring this up? In 1980 didn't really need this, because in 1980, often insurance companies weren't even that bad, to be quite honest with you. And there wasn't a mindset of the super general dentist that could do so many things that often were just delegated to specialists. So back in the early 80s, any perio went to the periodontist, and often really any extractions went to the oral surgeon, and endo, et cetera, et cetera. So the average GP would just, do basic crown and bridge. And so that isn't the case anymore. And also, the advancement of dental care, which, sorry, those of you that can see me, see that I'm fending off a cat right now. I love all animals, full disclosure. I've had pets my whole life, so they should be part of my podcast because they're part of my life. I had 2 golden retrievers in my office, roaming freely for 26 years. Now, that's not necessarily a recommendation, although I must tell you, there was 2 sets, by the way. They both lived till about 14, both sets. It was incredibly well received. And we've all seen them recently in upscale hotels, and there'll be a service dog greeting patients or whatever. It's not the point of this conversation. It's the point that there's a cat in my video. Sorry. So anyway, I cannot underplay. If you give the case presentation of your life and the significant other's not there, you are toast. You may not even get them to come back. So I would say, and I don't like exaggeration when I speak, I would say 70% of the time, 7 out of 10 times, that there is a new patient in my office that has some significant need indications, we have the spouse there. So how does that work? I just got to tell you that so we can get back into the process. So they make an appointment. The appointment times in my office for a new patient are an easy hour. That means they're 1 hour not scheduled against a surgery that I may be in, and I do a lot of surgery. Meaning that if I had to extend the visit and I needed more time, it wouldn't be a hardship on that day for me to do so. So that's what I mean by an easy hour. The patient comes in, they are acknowledged quickly. This is important stuff to me. Listen, in a day and age where patients can get their dental care for less money than they can in my type of office, you better have something that's palpable, that they can feel, that they can see and sense, that's different for them. Why else should they come to you? And there's absolutely a market for that. I'm not saying all corporate offices don't pay attention to these type of details. I'm saying a lot of dental offices, period, whether they're corporate or not, don't pay attention to such detail. So being on time is a significant part of this process for me. It is unacceptable for them to come into your reception area and sit for 5 minutes, for 2 minutes, without acknowledgement. And where does that come from? That comes from the morning meeting, that we haven't discussed yet. And that comes from a staff from top to bottom that knows what you think is important. Look, even after 38 years of this, I have to remind my team very often on a Monday morning that this is how I need it to work. I can never think that saying it one time or one time a month, and that's not a reflection of a bad staff. I think I have an amazing staff. It's a reflection that I have the most to gain and lose by all this. There's an old rule I usually use, and maybe it'll work for you, called do you need to pick up your kids at 2 o'clock at the bus stop rule? Do you need to pick up your kids at the bus stop, 2 o'clock rule? And what that means is no one, no mother, no father anywhere forgets to pick their kid up at the bus stop. You just would never do that. The consequences are just too significant. I need my staff to embrace my principles the same way as you would of picking up your kid at the bus stop at 2 o'clock. And that includes the second a new patient walks in. We don't have to set off party hats or sparklers and get carried away with this. But we do need to walk out to the front desk and say, you must be Mr. Smith? Hey, welcome to the office. And I hear that when I'm in the area, I hear that every single time. Sometimes they filled out their paperwork online. Unfortunately, that's unusual. So they're given their paperwork right away. And a staff member will come out within minutes, even if they're not done, they don't need to be finished, and bring just the primary patient, not their significant other, back into the operatory. So now, based on what I've told you before, it's obvious that they're not going to be surprised that we're going to take a full set of x-rays and do charting and all the stuff that needs to get done before I walk in the room. And again, this process came from a hygienist walking into my office or wherever I was in the operatories saying, they won't let me take x-rays. See, all of those bumps have been worked out through protocols that I have established on how I want to run my practice over the years and making sure my team understands that. So, the first thing that happens is they come back and they go again, this is important because I misspoke before, into a private office with the person that took the phone call, which in my case is Michelle, and they are with their significant other, and we do a re-review. Yep, we do a re-review of the mini dental history. And it's always a voice that is like, oh, by the way. So Michelle will bring them in. I'll tell you why we're doing this. So Michelle will bring them into an office and say, hi, good to see you finally in face to face. Hey, listen, I just want to make sure that I heard everything correctly and I got everything I needed to before you meet Dr. Rasner and the team today. I mean, by the way, can you imagine for most people hearing this, most offices don't do this. I get that a lot of you listening to me may do something like this, but those of you that are new, those of you that are in a rut, maybe you used to do this and you stopped doing it, this is good stuff. I mean, this is palpable. People can feel that, wow, this is different, because it is good stuff. How do I know? I can tell by their reactions. So this is before they even go to the operatory. They're in a private office, somewhere as private as you can make it. In my case, it's in my office. And Michelle's simply going over things. And why do I do that? I don't know how else to say this to you, except that people fib over the telephone, or they lie. Why do they do that? I think it's self-denial of where they're at in the process. So in other words, they might have told us over the telephone that they only have this one chipped tooth. But they get to the office, and even sitting across the desk, my new patient coordinator can tell that they have significant periodontal breath, or they're missing, or their mouth is jacked up. She can see it without sitting in an operatory with loops on. I mean, this is often. And I have thought about it for years as why this is the case. And I think it might be because it's a way of them protecting themselves, of thinking they don't need a lot, maybe because they're scared, or maybe for like we won't find this out. Maybe for financial reasons. I don't know exactly, but it happens enough that I believe you need to keep it as part of the process. It only takes 3 to 4 minutes. So she'll say, over the phone I asked you, are you missing any teeth? And you said, right? And a lot of times they'll open up. Sometimes they'll begin to cry. And as if to acknowledge that they weren't telling the truth over the telephone and that they really do have big issues. I'm telling you, don't skip this step, because it's another opportunity to prepare you, the examiner, the doctor, as to what you're walking. Don't you want to have as much information before you step foot in that operatory? Maybe Michelle will tell me, because the next thing's going to happen. So let me finish this. So then they are finished the process of the interview, the second interview, and they go into the operatory. And in the operatory, immediately, they're not sitting there waiting. They get their x-rays taken. They're charted for missing teeth, existing restos. This is done, of course, without the spouse. And then somebody will go to get the significant other, and I come into the office at that time. So, and we've never, not one time I can give you, ever had somebody stop the process and say, wait a minute, I just came here, I just want this tooth filled or removed or whatever. Why are you doing? Nobody's ever stopped us from that. And I'm not in the most sophisticated part of the United States, I have to remind you. And it even works in my part. And there's a reason to do all this. The reason is you are going to look at their entire mouth. And it is important to not surprise them with the process, because maybe they're not a match for your office. But I can tell you it's a rare, rare day when somebody interrupts that process. I can't even remember a time that's happened in recent years. Okay, so now I get to walk into the operatory. And by the way, it's not set in stone. If I see the process going on and I look in there and I see the patient perhaps waiting to get their x-rays taken and I know it's a new patient, yeah, there's times I'll pop in real friendly and say, hey, I'm Doc Rasner. I just wanted to say hi to you. I'm going to be meeting you shortly. I'll be back in. And that kind of a voice is everything, man. So listen, you've got to do things to separate yourself from the others. And so far in this process I'm giving you, we've done all that. I didn't talk physically about what they're walking into when they walk into the reception room, which obviously happens before. And I guess we could do a whole podcast on what that needs to look like. Let me just keep it brief. Let me tell you what it doesn't have to have. If you can afford it and you can have luxury waterfalls running down. I know there's some very successful dentists in this country that have those things. I remember Frank Spears' reception room in Seattle, Washington, from the many times I went there. It was over the top beautiful with expensive art and beautiful furniture. I mean, it was immaculate. I would live there in his reception room. I don't think it's unique to Southern New Jersey. I don't think you need that to be. I know you don't need that to get case acceptance. I do think what's important, without a doubt, is Walt Disney clean. I mean, a bathroom that's immaculate. And by the way, I can't help but give you caveats on how to get things on a consistent basis. So I have people assigned to cleaning the kitchen. So if I have 20 staff members, literally there's a sign with a calendar with week by week with who's in charge of that, who's in charge of the restrooms, so that nobody can say that's not my job. Make it everybody's job. And you know what, team members, if you're listening, you should want to do this, because you have a lot to gain from all this too, including wouldn't it be nice that you don't have to work evening hours or weekends? You know how you get to that? By being ultra successful of an office that you can be a little selective. Not in the beginning. In the beginning, you got to do whatever you got to do to be known. But wouldn't that be a nice thing for you? And that's your payoff not the least of which would also include top compensation or other benefits that go with a successful office. So you should want to do everything you can to contribute to that office reaching that goal. And part of reaching that goal would be a new patient walking in to always an immaculate reception room. Immaculate. The trash has to get changed because it just doesn't look as fresh as it does first thing. Then do it. Somebody has to be in charge of these things. Somebody has to care. You know, in terms of how opulent I get, listen, I had flowers delivered every 2 weeks, one whole year to my office. Is that necessary? It's nice. I don't think it's necessary. Having snacks and a little station like that with little toothbrushes for this patients, I think that's a wonderful thing, and we've had that for years and years. Like usually on top of a refrigerator, a stylish looking refrigerator. In my refrigerator, there's waters, juices, lots of stuff, all kinds of fancy coffees for them to use, and with a little sign, feel free to freshen yourself up, and here's a toothbrush before you see the dentist. This little disposable toothbrushes. So I think it is worthy of mentioning in this process that they can't walk into, the Ralph Waldo Emerson statement of quote of "Who you are, speak so loudly I cannot hear what you say." Covers a lot of bases, and I think it covers this base. You can't say you're this amazing one-on-one personal different office and have them walk into a dirty bathroom or a untidy reception room. So sorry to deviate, but it is part of this, and I've got to hit all these as they come to my mind. Okay, so now they go back into your operatory, and now they finally meet me. And I'm going to walk in, and I'm not going to give you the whole thing now because I'm going to save it for the next podcast. But I will tell you this. I'm going to walk in clean myself. I am going to brush. I'm not kidding. I am going to brush my teeth, if not wash my face. I am not going to take the chance that I have a spinach leaf between 7 and 8 on one of my teeth. Listen, there's studies have been done by people way smarter than me. And I don't think you need to even look them up because it's true and it's true. People make judgments on you in seconds. And when we're done these podcasts, if we ever do get done them, I'm going to cover everything, including your marketing, that makes you look like a stud or star. So they think they're going to a star. So you have that upper hand before you ever walked into the operatory. If you've managed your team properly by having them do all the preparatory things I've just alluded to, before you walk in to the husband, wife, or significant other in the operatory, and the significant other, by the way, is in the assistant chair, then don't blow it because you have onion breath or something, or you've got a piece of emperor gum or something on your face that they're going to notice. God forbid the operatory is not immaculate. I'm talking not just a half of a gutta percha stick on the floor somewhere. It has got to be scrubbed, cleaned, ready to go. And then you're ready to walk in. And it's an always, oh, by the way, initial approach. Warm. I sit down, my operatory. I look at him and I'll say, hey, I'm Dr. Steve Rasner. Welcome to the office. Really nice to meet you. How did you hear about us? That's what I always say. I try to warm it up, bring their defenses down. And it's a good comment to make because sometimes they'll say something they haven't said prior to Michelle in the mini interview. And, it's not the greatest thing. It is the greatest thing if you can find out in the very beginning that you treated a family member or several members of their workforce, because it gives you, if nothing else, confidence. And you better be sure that the number one thing that's going to get you to yes is the vibe they get from you, the confidence, the passion that you're into it. Yeah, do you need to be nice? Of course. I mean, warm, but they are looking for confidence. They are looking for passion. And I'm going to teach you in the next podcast or two how to portray that. That is more important than any model systems you're about to show them later in your presentation of what a fixed implant hybrid looks like, or a little video you paid for that you're about to show them the process of implant or bone augmentation or root canal even. I'm telling you, your vibe does everything. And when I say the vibe, I don't know how else to say this. I like to be down home. I like to be someone I am thinking all the time. I'm not thinking all the time, but you should in the beginning. I'm thinking of, I want them to trust me and believe in me. Trust means I'm going to give them an honest appraisal of what I think they should do. And if they can't do it, that's fine, then don't do anything. So there's a lot of examples of that. The quickest one I can think of right now would be a patient that comes in. Okay, here's a scenario I'll leave you with this podcast. A patient presents to you with dentures, upper and lower dentures. And you might have made their denture, this is a true story for me, and you might have made the denture, the original denture, 20 years prior. And now they didn't feel like paying your fee, so they went to wherever, affordable dentures, a lesser expensive alternative. And now they're miserable. They got their dentures quickly and they don't fit correctly. And you examine them and they have an atrophic mandible. So it doesn't matter whether they went to Earl Pound or Masad or the most knowledgeable anatomic person in the United States when it comes to denture fabrication. They have an atrophic mandible. So it is important that you have enough integrity to be as honest and earnest as you can when you speak to these people and say, in this particular case, listen, I know you want me, and it's flattering that you want me to come back to me because I know you said my first denture. Here's how I would talk to the patient. My first denture was amazing for you. Guess what? I'm happy that was the case, but your first denture is always your best denture because you have something more of back then that you don't have anymore, especially on the lower, called bone. It's harder now, no matter who makes it, including me. So my job today is convince you of your options. And one may be to use Fixodent. It may be to do nothing, because you're going to hear me talk about an advancement in dentistry that wasn't as common 20, 25 years ago, that involves implant dentistry. And my observations, I'm talking to you right now, my audience, is that almost everybody I know, even older patients today, are somewhat familiar with the concept of implants, and their initial reaction is either they hurt a lot or they're really expensive. And hurt a lot you can get past. Your job is to be as thorough and describe that as you can, and be willing to let the patient pass. Don't get talked into making one of your dentures because you make them so amazingly better than everybody else, or even a reline. So I'm going to leave you on that today for this podcast. I hope everybody has a great rest of your day. I hope this contributed some way to your success. And I look forward to seeing you on my next podcast.